Before we dive in, this video is for general information only and is not a substitute for advice from your GP, pharmacist, or specialist. Always speak to a healthcare professional about your individual circumstances. Can fatty liver disease cause diarrhea? It's a question we hear more often than you might think, and the answer is more nuanced than a simple yes or no. Fatty liver disease affects around 1 in 3 adults in the UK, yet many people only find out about it through a routine blood test or scan. Once diagnosed, it's completely natural to start connecting it to other symptoms you've been experiencing, including changes in your bowel habits. So let's look at what the evidence actually says. Here's the key point. Uncomplicated fatty liver disease, where fat has accumulated in the liver but hasn't progressed to more serious damage, is not directly associated with diarrhea. NICE guidance and British Society of Gastroenterology literature both support this. So if you have a straightforward fatty liver diagnosis and you're experiencing diarrhea, the liver itself is unlikely to be the direct cause. That said, there are indirect ways the liver can play a role. The liver produces bile, which helps your body digest fats. In more advanced liver disease, the composition and flow of bile can be affected, and this can potentially contribute to something called bile acid malabsorption, which may cause loose stools in some people. Medications are another indirect factor worth knowing about. Some commonly prescribed treatments for conditions that often go hand in hand with fatty liver, such as metformin for type 2 diabetes or GLP-1 receptor agonists, can themselves cause diarrhea as a side effect. So the medication, rather than the liver condition, may be what's affecting your digestion. Importantly, please don't stop or change any prescribed medicines without speaking to your prescriber first. It's also really important to consider what else might be going on alongside a fatty liver diagnosis. Conditions like type 2 diabetes, irritable bowel syndrome, and celiac disease are more commonly seen in people with fatty liver, and any one of these could independently explain persistent changes in bowel habits. Recent dietary changes, particularly if you've adjusted what you're eating as part of managing your condition, can also affect your digestion significantly. So what should you be discussing with your GP or healthcare professional? If you have fatty liver disease and you're experiencing diarrhea, it's worth asking whether any of your current medications could be contributing, whether conditions like IBS or celiac disease have been considered, and whether any recent dietary changes might be a factor. In terms of managing your overall digestive and liver health, the evidence points towards lifestyle as the foundation. A Mediterranean-style diet, gradual weight loss if that's appropriate for you, and regular physical activity are all recommended approaches. Your doctor can guide you on what's realistic for your individual circumstances. Now, when should you seek help more urgently? Please do contact your GP if diarrhea persists for more than 2 weeks, if you notice blood in your stools, if you're losing weight without trying, or if you develop severe abdominal pain, a high fever, or signs of dehydration. Also seek prompt attention for any signs that your liver disease may be progressing, such as yellowing of the skin or eyes, or significant abdominal swelling. If you're acutely unwell, contact NHS 111 or seek urgent care. It's also worth knowing that people with fatty liver disease are advised to have regular monitoring. NICE recommends non-invasive tests such as the FIB4 score, the NAFLD fibrosis score, or the ELF test to assess how the liver is doing over time. The choice and frequency of monitoring will be guided by your healthcare professional and local pathways, so if you're unsure whether you're being monitored regularly, raise it at your next appointment. So to recap, fatty liver disease on its own does not directly cause diarrhea. Indirect factors, including certain medications, bile changes in more advanced disease, and coexisting conditions, may be responsible. And persistent or concerning bowel symptoms always deserve a conversation with your GP. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information.